Well, thank you so much for coming out. I'm so excited to be here. We're here. Can you hear me? Closer? I can hear it now. Okay. Okay. I'm so happy to be here. Thank you so much for coming out. So, as you heard, we are Heart to Heart World Mission, and we're here to support your community. And we have a lot of very interesting topics to discuss today. We have a lot of health issues that we can discuss today so that you guys will have a great understanding of how they work and how to get help, and even to figure out how we can make some lifestyle changes so that maybe we can reduce some of the issues and maybe reduce some of the medications. We'll see. But it's a pleasure for me to introduce our team. So I'm going to invite the team to come up. I'm going to ask Dr. Swaby to please come up. Dr. Swaby is a physiatrist. He handles pain management. He handles stroke. He handles stroke, and so he is a great person to talk to about all the different kind of pain ailments, okay? I have Dr. Earl Campbell. Dr. Earl Campbell, he's our pulmonologist and internal medicine. He'll handle questions about lungs, health, and any other questions you can have. He's an all-arounder, okay? I have Dr. Sandy Dunn. Sandy? There you go. She is our cardiologist. Okay, excellent, excellent. Okay. Okay. Oh, okay. Okay. Also, I have Dr. Cooper. Yes, Dr. Cooper. She is our family practice doctor, and she does practice here in Jamaica as well. No longer? Okay. Okay. We have okay. Let's see here. I'm looking around for Dr. Abby. Is he here? Dr. Abby, come on down. Okay, he is our OBGYN specialist. And I have, let's see, is Dr. Hart here? No? Okay. Then I have Miss Paula Allison. She is a nutritionist / educator and lifestyle coach. So please come on board. Okay. Who am I missing? Chantal. Chantal Samuel. She's our nurse practitioner. She does OBGYN, she does GI, and she does pediatrics. Okay? Okay, wonderful. And I'm going to invite Dr. Hope Campbell. She's our pharmacist, and she's going to go ahead and address the panel.
Thank you so much. Well, it's so great to see everyone out. We want to honor your time, and so we're going to jump right in, but I'd like to give you an idea of what are some of the topics that we thought you might be interested in, but just to give you an outline of what we're going to be doing. Sleep, for example, obstructive sleep apnea. We'll talk about what that is. How do you know you might have that? What are some of the risk factors for you having that? And then we will look at, just for the ladies, menopause. Yes, as we do this together. Okay? All right. But not to leave out those who think they have skipped it or haven't quite gotten there yet. We'll certainly touch on perimenopause, the time before. All right? And then we will also be looking at some of the staying in the vein of women, okay? we will be talking about some female cancers, okay? What should you be aware of, what to think about. And then we will be looking at some of the infectious causes or infectious diseases associated, sexually transmitted diseases, etc., that affect both men and women. And what we have seen, we've been here multiple years, and we've done 2 days already in the Portland area. And tomorrow we're going to be at Fellowship School. And so if we don't get to everything here and you want to come and see us, we'll be happy to have you tomorrow. As well as on Monday, we will be at Portland High. So following on, we're going to be talking about cardiology, the heart. We're going to be taking a peek, not to leave the men out. We'll look at prostate cancer and heart disease. And of course, what covers and encompasses all our health is healthy living, nutrition, healthy lifestyle, and that is something that Miss Allison will be directed at. So let me start. I probably should start with you, Paula. Would you like, Paula is a local to Portland. Would you tell us about what it is that you do for the community and how you relate to this health team?
Yes, thank you so much for that opportunity. What I do for the community is to provide education. As said before, I'm a registered dietitian. Sometimes I call us nutritionists, and I'm also a certified diabetes educator, and I've been doing this for over 30 years. So what I do is to provide education, and a lot of times people think it's all about the food, and it's a lifestyle. And so I look at every different aspects as a complete person. So I'll teach people about their sleep. I mean, are you going to bed early? You know, are you being active? You know, are you drinking enough fluids? So we look at different aspects because a lot of times we tend to focus on only genetics and we're not realizing that our lifestyle plays a big part in where our health is today.
Absolutely. There's some things we can change. There's some things we can't. Thank you for that. And again, Ms. Allison is local and will be here to manage and to help you navigate the healthcare system for some of those chronic illnesses that you may have when we are all gone. All right. Dr. Dunn, let us start with the heart. Some might say that that's the most important organ. What really is heart disease? What encompasses heart disease? And how can I prevent? Is there anything I can do to prevent heart disease?
Thank you for that question. So essentially, a lot of times we say the term heart disease, and a lot of people might not fully understand it. It incorporates essentially everything that contributes to the heart and allows it to function, which is the blood vessels that bring blood to the heart, not just through the heart, but also to the muscle of the heart. Also, we might also be discussing diseases that can affect the muscle of the heart. The heart is a huge system. We actually call it the cardiovascular system because everything starts with the heart. All the major blood vessels, the heart brings oxygenated blood throughout our entire bodies. If for any reason any of the system is affected that controls how the heart functions, that's what we refer to as heart disease. Now, even though there can be some genetic components to it, a lot of times there are lifestyle choices that can contribute to heart disease. And so my main function and the function of anyone who practices cardiology is not only to treat treat these diseases in order to prevent heart disease, or if you already have heart disease, to take care of you, but also to prevent you from getting to that point where you need to see one of us. So the three major components that you can say, okay, what contributes to heart disease? The ones that we can change is high blood pressure, diabetes, and high cholesterol. So those are the three major ones that we like to touch on. In terms of high blood pressure, as a matter of fact, in terms of all of these diseases, the only way you will know if you have any of this is to see a doctor. Now, I know in Jamaica a lot of times our thing is, oh, we're not going to go to the doctor unless we feel sick. You know, like, I feel fine, I don't need a doctor, I can drink bush tea. That's not necessarily the case. You know, you going to the doctor even once a year, you're just to get regular blood work done, that's the main thing. Going to get checked up to see what your blood pressure is, that's a huge thing. So one, just going to the doctor, finding out if you have high blood pressure, if you have high cholesterol, or if you have diabetes.
Let's keep trying.
Okay, are we good?
Yes, I'm hearing you.
So the second thing is actually taking the medication that they give you for these diseases. Now, I know because, you know, I am Jamaican, I have Jamaican family, and in the past 2 days that we've been treating in the community, a lot of people, they'll start to take the medication. Jamaicans don't like to take medications. Like, I'm pretty sure this is a common thing. I'm sure it's common along Caribbean people. We don't like to take meds. You rather drink the bush tea, the garlic tea, all of that stuff. But taking your medication is really the most important thing. The next, in regards to taking your medication, if you take it today and you don't take it tomorrow, guess what? It doesn't cover your blood pressure for tomorrow. It doesn't cover your blood sugar for tomorrow. So it's very important that you take your medications every single day as the doctor prescribes it. Only your doctor should stop you on your medication. You can't stop yourself, right? And if your medication runs out, go back to your doctor, go to the pharmacy. You need a refill, you have to continue it, okay? There's only certain conditions where your doctor will stop your medication, and if they don't stop you, I encourage you to keep on taking it. Now, if you want to not take medication, you know, as I said, go to the doctor, get your blood pressure taken. If you're borderline, you know, they see you going to that point, or if your blood pressure is high and it's not too high, they might even say, hey, you know, we'll encourage you to exercise. Exercising plays a major role in controlling your blood pressure. If you're drinking too much alcohol, cut back. Alcohol, if you're smoking, you know, all of that.
We're in the church of the Lord.
I mean, we would hope you're not. But if you have family members, because
To tell your family, okay.
tell your family, tell your friends, you know, cut back on that or stop doing it completely, right? If you're stressed out, so stress contributes a lot to blood pressure. So, you know, getting physically active, sleeping well, you know, taking walks, all of those will help. Breathing, meditation, whatever it is you need to do to help to reduce your stress levels, that will also improve your blood pressure.
Thank you so much, Dr. Dunn. That was quite a bit there, okay? I think what we have seen is a number of patients have come in and they have had high blood pressure. Did anybody tell you had? Yes, they did. Did they ever give you any medicine? Yes, they did. And what happened? Well, it finished, and so I thought it was good. This is not something you're going to grow out of. This is not something that you get over, but this is something that you can manage. Isn't that beautiful? I used to have to tell my mom, you were born in good time. God has already provided an answer to your problem. Imagine that, even before you knew you needed a blood pressure medicine. Now, as Dr. Dunn has said, there's so many things that we can do to support healthy living along with. If we can do it without, absolutely, but more than likely, quite often, we do need the support. And you're right, Dr. Dunn. As a people, we're not too excited often about medications. By profession, I'm a pharmacist. So unfortunately, I'm the one who's going to encourage you. There are people who have spent their lifetime studying. God is the person who giveth all the wisdom and the knowledge about the drug for the healing of the nation. All right. All right, let us leave the heart for a little bit there. I want you to know, if you have questions, we'll take questions at the end. Miss Sylvia up here, Mr. Brown has some paper. If you do not wish to stand up when the time comes to ask your question, you can write it down. It will pass to me, and then I'll have it so you can remain anonymous, okay? Very well. Okay. Let's talk a little bit about women. Women make up most of this panel here today. Let's start with them. Dr. Alidepo, you are a physician who specializes in women's health, okay, an obstetrician gynecologist. One of the things that is of concern to us as women, we've just been losing too many friends, too many girlfriends to breast cancer or cervical cancer, uterine cancer. Is there something that you could share with us that could help us to be more vigilant as it relates to recognizing these cancers?
Thank you for that question. I'm going to take the question according to the organ she's mentioned. The first one is the breast. Now, all over the world, the most common cancer in a woman is breast cancer. It accounts for 1 in every 4 cancer a lady has. So it is very important. The good thing about breast cancer is that if we're very mindful of what to look for, find them early, we could actually catch them early, sometimes before they become cancers. And one thing I would want to say about all cancer is they start as very tiny cells that are not visible to the naked eyes. If we ignore them, they grow into lumps. If we ignore them, they go into other organs. If we ignore them, it kills. So with regards to breast cancer, one of the most important things is breast examination. Either your doctor does that, or you as a lady can do that yourself. You know your body more than any doctor does. And it's a very simple way of doing this. Essentially, find a time when you're alone. Get a good mirror. There's no lady who hasn't got a mirror. We carry them about in our wallets and in our purses. So it's not something that's out of the ordinary. When you're ready, shut it on yourself. Take off your blouse. Take off the blouse. And take the bra off. Stand in front of the mirror with your hands on your hip. And what you're trying to do is look at the 2 breasts. Is one smaller or bigger than the other one? Ideally, they should be of equal size. Sometimes one is smaller, but it doesn't mean it's not right.
It's my closer.
Sorry.
It's unidirectional, I think.
Now, the other thing to look at is the nipple. It is very, very important. Is it normal, like it's protruding, or is it actually gone inside? If it's protruding and is okay and you don't have any discharges, the commonest discharge is bloody discharge. And that type of cancer accounts for over 80% of all breast cancer. So don't ignore it. Don't say, oh, maybe it was my brother caught me there or whatever. As soon as you notice any bleeding discharge from your breast, you want to contact a doctor. The other thing you want to do is have a look at them. Do you have any puckering of any part of the breast? Those are signs of early cancers of the breast. The next thing you want to do, put both hands together and raise it above your head. And then you can actually see whether one droops down or lies funny compared to the other. But the most important thing to do is how to examine your breast. Now, with the examination of the breast, the best time not to do it is when you're on your period, because it's very tender then. You may not be able to feel what you're looking for. And because of the pain, you may not do it properly. What you want to do is with the pads of your 3 fingers, not the tip, the pad, the swollen bit. You want to look at the mirror and sort of look at the breast and sort of divide it into the face of the clock. You either want to go from 12 to 1 to 2 to 3 to 4 to 5 to 6 and back to 12. Essentially what you're doing is the flat of your 3 fingers, you want to start from just above your chest and feel downwards towards the nipple. What you're looking for are little lumps. Now, sometimes you have breast lumps that are benign. They're called the breast mouse. Okay? Very common in younger ladies. They're very tiny. They're not painful. If you move them around, they quite actually move around easily. But if you're worried and you have a breast lump that's a breast mouse, you need to see your doctor for reassurance. Okay? The next thing you want to do is lie flat on the bed. When you lie flat, the volume of the breast is flat, and it's a lot easier to feel then. So you want to palpate for lumps. Once you've done that for both breasts, you want to feel your armpit. Sometimes when you have breast cancer, just like when we were younger, when boys play football and you hurt yourself, you have a sore on the foot, but you have swelling and tenderness in your groin. It's drained by lymph nodes. The lymph node that drains the breast goes to the armpit. You want to feel for your armpit for lumps. That's as far as breast goes. Very easy, very simple, but very common cancer.
How often should that examination be done?
Yes, I think it's not nice to be prescriptive. I would say if you are able to, every month, but if not, every 3 months would be ideal. And if you have any problems or if you're not sure what you're doing, you want to make an appointment to see your doctor.
Fantastic.
Now, should I go on with the others?
You can go ahead.
Yes. The next common problem is cervical cancer. The rate of cervical cancer in non-developed countries far outsweeps the number we have in developed countries. The unfortunate thing is that it's one of the most preventable cancers in a lady. The cervix is the neck of the womb. What I tell my patients is, if you imagine the womb as a balloon blown up, and you tie the neck just to keep the air in, that neck is the cervix. We're fortunate in the sense that apart from the breast, the cervix is the most easily accessible genital organs to the doctors. All we need to do is put in a speculum, and there it is. We cannot see the womb. We can see the neck of the womb or the cervix. We cannot see the fallopian tube. We can see the cervix. We cannot see your ovaries, but we can see the cervix. So it's the most preventable cancer in the female. Now, the best way to go about this is to have your regular pap smear test done. Now, we start pap smears from the age of 21, sometimes in some countries 25. And essentially, what they're looking for is they use a stick to sort of rub around the cervix or the neck of the womb in the hope of collecting cells, which I say are not visible to the naked eyes. They put them on the slides, send them to the lab, And what they do is compare your cells to what we expect to see. The good thing about cervical cancer is that it moves from what we call pre-malignant cell changes before they become cancers. Oftentimes, it takes between 10 to 15 years for that to evolve. So you got a lot of time to catch it before it becomes cancerous. The cell changes come in 3 forms: mild change, moderate change, and severe change. However, we've grouped the moderate and the severe one in one class and the mild one in another class. The good thing about the mild ones is 90% of them resolve on their own. When you come back with a pap smear that says mild change, we tend to reassure you and say, well, we'll see you again in 6 months or 1 year, depending on how easily it is for you to assess your doctor. Now, a lot of the mild changes occur in girls under the age of 20. And the reason this happens is because 90% of cervical cancer is caused by a virus called HPV. Now, in younger girls, it's a lot common, and what we don't want to do is start early, get the cells to come back as being abnormal. These girls just wear them out. So we wait until the age of 21, sometimes in some countries, 25, okay? The good thing in some other countries is we now have vaccinations for young girls in school, and that prevents the HPV. So that's as far as cervical cancer goes. So the main thing for cervical cancer is the pap smear. Between the ages of 21 to 45, you need to have it done once every 3 years, not unless there's an abnormality. You've got to make it religious, just like you go to church on Sabbath. If your pap smear is due, call up your doctor or find somebody to do it for you. Maybe the community nurse can do that for you.
Dr. Addy, I see Dr. Cooper over there who has practiced here. Dr. Cooper, are there any differences in when we start here in Jamaica and what's available here?
We start at 21, and it's usually recommended to do it every year. That way we'll catch more people. And it can be done at your health center, or the Jamaica Cancer Society does it, both in Kingston, and sometimes they'll have health fairs where they will come and get it done. But if you check your health center, and of course your private doctor, whether it's an OBGYN or your family medicine doctor, can do it too.
Very well. So it's nothing for a young lady to be scared about.
No, nothing at all.
It's nothing painful, not usually.
No, it's not painful. It's
Okay.
just a little uncomfortable, but not
All right.
painful.
Go ahead now, doctor. I know you had some other cancers there.
Just one more thing about cervical cancer. I said that the most preventable cancer is in the female. And the only way you can help with that is, 1, stop smoking. It's a big factor in cervical cancer. Okay? Multiple sexual partners. Okay? Very early coital age, that is having sexual partner at a very early age. Okay? And HPV. If you're, I don't know what the situation with HPV here is, but
The HPV vaccine is available here in the public sector. It's given to girls age 9 up through, I think, 26, women up to 26. So it's available when you take your daughters to get their immunization before they go into high school. You can ask the nurse about it.
And moms, you shouldn't be afraid of your daughter getting this vaccine. Some people are kind of concerned, it's going to make them start having sex, No. Okay? Go ahead.
I'm sure. Is it available for the boys as well here as yet?
Not yet.
Okay. Because it's also available
In the
for young
States, it's
boys,
available
yes.
for boys.